Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. 15 minutes past 8 o'clock. It is Wednesday morning, the 11th day of February 2026. Good morning, everybody. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM over the air right here in San Juan County, New Mexico. In Durango, Colorado, we broadcast at 103.3 FM. And if you're listening to my voice anywhere else on planet Earth, you've gone to our website to tune in, ksje.com, or maybe you're listening through the new KSJE radio app. We also want to welcome our viewers who are joining us this morning. The video of this program is streaming out live to the KSJE Facebook page and also to our YouTube channel. So welcome aboard, everyone. So glad that you are with us, because coming up in the next few moments, we are getting some good advice about being heart healthy, and during National Heart Month, of course, the month of February. So stay tuned for that. My guest from San Juan Regional Medical Center coming up in the next few moments right here on KSJE. Then later on this hour, we'll be checking in with some students from Farmington High School about their upcoming event called All That Jazz. That's coming up today, 8:50 a.m. on KSJE this morning. Nick Hess will take over the studio at 9:06. It's our weekday classical music program, Roving with the Arts. You will hear that coming up in a little less than an hour from now on KSJE. That'll take us to 10:30, and right on Four Corners, our local and regional author program. Utah author Melissa Bowersock is our guest this week, and Melissa Bowersock is talking with host Del Cherie Spinner about her latest book called Missing Walk. That's coming up today at 10:30. Don't forget, you can also connect with us on other forms of social media, and you can find our podcasts wherever you listen to podcasts. We publish new podcasts almost every day. So check it out and maybe discover a new local program that you may have missed recently. And there it is, the KSJE radio app. It's available at the App Store and Google Play. You get our podcast right there. You can listen live and much, much more. Outside our studios here at San Juan College, it is 40 degrees this morning. We are expecting a mostly cloudy day today, 50% chance of rain showers, maybe some snow in the higher elevations. The high reaching 56 in Farmington, 38 overnight. Partly sunny tomorrow with a high of 59. Then again, another chance of showers on Friday with a high of 51 and a low of 32. Maybe sunshine and 55 by Saturday. Back with my guest with more right after this on KSJE. In a medical emergency, stroke, heart attack, trauma, every minute matters. The decisions made in those first moments can change everything. San Juan Regional Medical Center offers advanced, comprehensive, definitive care. Available 24 hours a day for everyone in our community. When minutes matter, San Juan Regional Medical Center is here. Find out more at sanjuanregional.com. Ready to make a difference close to home? The University of Denver Graduate School of Social Work Four Quarters program is accepting applications for the 2026-2028 Master of Social Work cohort. Classes meet Fridays in Durango, letting you keep working. Learn more at du.edu/socialwork/fourcorners. Students can change the future with DU and apply now for lasting impact.
Now back to Studio A and the award-winning Scott Michlin morning program on KSJE.
And back in the studio this morning, as I mentioned, my guest this morning from the San Juan Regional Heart Center, Dr. Stephen MacKerrow, is here this morning. Dr. MacKerrow, good morning and welcome.
Good morning.
Good to have you here. Thank you for being here to talk a little bit about our hearts and healthy and how to stay healthy, those types of things. And you've been here we were talking before we came on the air this morning, about 7 years almost this year.
Right.
Time flies, I guess, when
Sure does.
when you're having fun, right? And so this is February. You see a lot of patients, I guess, and your colleagues at the Heart Center with heart issues, heart disease, and things like that. And so, I guess my first question would be to give us some advice on how to be maybe a little bit healthier when it comes to our heart. We only have one, right?
That's right.
Yeah.
Well, we always tend to give advice, February being Heart Month, and ways to reduce the risk of having a heart attack,
Right.
which is usually most people's biggest concern. What can I do to lower the risk of having a heart attack? And I'm sure most have already heard this advice, but it's generally a heart-healthy diet. We recommend the Mediterranean type diet. And of course, exercise. The American Heart Association recommends that everyone should strive to get about 150 minutes of aerobic exercise per week, in addition to strengthening exercise, such as weightlifting, other kinds of isometric exercise for about 75 minutes a week, if possible.
Okay.
I'm sure everyone knows about smoking cessation, trying to maintain an ideal body weight, and then, of course, treatment of the usual risk factors, which would be high blood pressure. The current guidelines recommend a blood pressure of 130/80 or less, pretty much for all adults. Treatment of diabetes. We have a huge diabetes problem here in San Juan County. And
So that contributes, I guess, to heart problems, right?
huge influence, especially in the native population. And then, of course, treatment of high cholesterol.
Right.
So those are kind of the general guidelines.
Sure.
For most people.
Right. And you're right. We've heard about that. I mean, I've heard of them before, but yet we still do these bad habits, I guess. So it's worth repeating, I would guess, right? For folks to be able to remind us that this is the things we should be doing, or at least striving to get closer to doing. And that's the idea. I know that the hospital is going to be part of the Healthy Living Expo that is coming up later on this month. And that's another opportunity for folks to come out and maybe learn more about the options and the resources and services that are available here in San Juan County. It's an event being put on by the Health Council, but I know the hospital is a big partner, I think, in doing this, right?
Right. Yeah, that's going to be on February 21st, Saturday, over at McGee Park. And there will be opportunities there for getting more information on risk factor modification, what we just talked about, blood pressure checks. We'll have the weight loss or bariatric program representatives there to talk about that, and just a lot of useful information for people who might be interested in that. So,
Yeah, great. And that's a free event.
Yes.
For folks to attend, and we talked about it here on the program, so regular listeners and viewers will be familiar with that as well. But it's a great free event for folks to go out to McGee Park, and again, the hospital will be there. Lots of other vendors and others will be there talking about ways to have a healthier lifestyle, maybe ways to do some of these healthier eating things you're talking about, or exercises or weightlifting that you're talking about. All these opportunities. So it's a great one-stop shop, I would think, for a lot of folks.
Yeah, and that will be from 10 a.m. to 3 p.m.
Right.
on that Saturday.
Yeah, very good. So that's important. Are you going to be out there, do you think?
I'll
You might
try
stop
to be,
by?
yep.
Okay, fair enough. Very good. We were talking too before we came on the air a little bit about you and your colleagues, and I know the hospital, by having and starting a heart center here, has tried to collect a bunch of professionals to be able to meet with patients and treat patients, and maybe even take care of some of the conditions that patients show up with. That's always an opportunity too, so folks don't have to travel too far to get treatment, to get it done right here in Farmington and San Juan County. Is that kind of the ultimate goal?
Yes, our goal is to provide as comprehensive cardiac care as we can. We're the largest hospital in a 300-mile radius, and we're fully staffed and equipped to deal with acute heart problems, as opposed to what you might run into, say, at an urgent care center, Generally, if you're having chest pain, we would recommend that you go to the hospital. That would be the first choice, to our ER, which is fully equipped and ready to deal with anyone having a heart attack. And we see a huge patient population. I mean, we have a very large number of patients that come in from outlying areas, that are transferred here. And we recently got reaccredited as a chest pain center by the American College of Cardiology. And that was actually just in the last week we got our reaccreditation for that. So
you're saying that's breaking news. I like when people come to me with breaking news, Dr. MacKerrow, so thank you for that.
Yeah, we were accredited before and just went through the whole process of reaccreditation. And what that entails is being able to provide basic and crucial services for patients having heart attacks. For example, cardiac catheterization, stent placement in coronary arteries for people having a heart attack, having a cardiac rehab program, and providing care that's consistent with the current guidelines put out by the American Heart Association. So they had representatives come out here from the American Heart Association and American College of Cardiology and inspect our facility. So there were a lot of hoops we had to jump through, but we did get the accreditation.
Nice.
So that's good.
That is very good. Congratulations.
Thank you.
That's not an easy thing to do, and not every hospital gets that accreditation either, right?
Correct.
So that's important as well. So very good. And I would think too that it's important that folks are able to know that they can get treatment. I've always heard that when someone's having a heart attack, time is muscle. Is that still the rule of thumb for
absolutely right
for treatment and to be able to get somewhere quickly so that the doctors and surgeons can start whatever treatment is required, so there's not more damage done to the heart and the heart muscle?
Yeah, so the general goal is if someone is having a heart attack, and if they're a candidate for going to what's called the cardiac catheterization laboratory, where we get a picture of the arteries, the current national guidelines are that should be done within 60 minutes of first medical contact with the patient. So, for example, if the patient walked into the ER or if they were seen in the field by the paramedics, our goal would be to get them into the cath lab and try to get the artery opened up within 60 minutes, which we have been able to meet in most patients. So yeah, to answer your question, time is absolutely essential. So
right, and I guess if that time, I mean, if someone is coming in from further away or what have you, there's still reason to try to get them in as quickly as possible, even if you can't meet that 60 minutes, right? I mean, obviously you're going to still treat the issue.
If they're being transferred in, say from an outlying Indian Health Service facility or other areas, the current guidelines are that the goal to opening up the artery is 120 minutes or less. So
gives you a little more time too. And I imagine too, if someone's coming in by ambulance, those EMTs can start doing some procedures or radio into the ER or the cath lab what's coming and how to be ready, so that when the patient does arrive at the hospital, your folks can jump into action, as it were.
Right.
So that's important as well. There was an issue we were talking about, or a screening that we were talking about too before we came on the air, that's relatively new that folks are maybe hearing about, that you want to talk about too a little bit. Talk to me about that.
Right. So there's a test that we've had a lot of questions and interest about called coronary artery calcium screening test. It's an outpatient test. We've been doing it at the hospital now for a number of years, but the popularity of the test has increased recently. And what it is, it's a CAT scan of the heart, a CT scan of the heart, a non-invasive test. It takes generally 10 minutes or less to do. And what it generates is a score of the amount of calcium that patients might have in their coronary arteries, and calcium is associated with coronary artery disease. So generally, a score of 0 would mean that you have no calcium in the coronary arteries, and a score that's positive generally gives a reflection of how much plaque or atherosclerosis you have in the arteries. So, for example, a score of 400 would be considered extremely high. A score of 100 or less would be considered mild. The test is generally, believe it or not covered by Medicare or most insurance companies, but it's not extraordinarily expensive. It's probably on the order of around $100, maybe a little less out of pocket. And we've had a lot of questions asked by patients, should I get the scan? So it's useful in certain groups of patients. If you already have a known diagnosis of coronary artery disease, it's not useful. It's not going to change management.
It wouldn't tell me how severe or not it is, or would that be worth knowing?
Not if you already have an established diagnosis of a heart attack or coronary artery disease.
I see.
If it's a patient who's extremely low risk for having coronary artery disease, for example, age less than 45, non-smoker, not a diabetic, not hypertensive, their cholesterol's normal, they don't have a family history of coronary artery disease, it's probably not a useful test. The main usefulness is in patients who we consider intermediate risk for coronary artery disease. So, for example, they may have some risk factors for coronary artery disease, and particularly in patients where either their provider or the patient are trying to decide, should I take a statin drug to lower my cholesterol or not? And in that group of patients who are what we consider intermediate risk, we always try to estimate their 10-year risk of having a heart attack or stroke with certain formulas that are out there. There are certain protocols that can be used to estimate 10-year risk. And if someone has an intermediate risk, which is a 10-year risk of generally more than 7.5%, but less than 20%, that's where the CAT scan, the coronary artery calcium score, may come in useful. And the other usefulness may be in motivating some patients who may not be motivated to change their lifestyle or to take a statin.
Right.
And if they have the scan done and they actually see a picture showing that they do have coronary artery disease, that tends to motivate a lot of patients. And they'll say, okay, well, I'm going to get on the ball here with changing my risk factors or perhaps taking a statin drug to lower the cholesterol. The other group of patients where it may be useful in is if they're low risk, but they have a very strong family history of premature coronary artery disease. In that situation, it can be useful. For example, if they were low risk, but the scan came back positive, you might think then of potentially starting them on treatment for high cholesterol, that sort of thing.
I see. Interesting. And I guess does the scan, I would assume, because I'm not a doctor, but you are, and I'm glad that you are here, would the scan show you the amount of blockage or the amount of disease maybe in these coronary arteries, and the doctor could see
that's a
that?
really good question, because what it shows is the total amount of plaque in your coronary arteries. However, it doesn't necessarily mean you have a severe lesion.
I see.
There are many people walking around who have high total scores, but it doesn't necessarily mean they have a severe lesion. And the test should not be used to order further cardiac testing if the patient is asymptomatic, if they don't have symptoms. So, for example, if someone had a high coronary artery calcium score, but they're active and they're not having chest pain or severe shortness of breath, it's not an indication to start doing more tests like a cardiac catheterization. It's not an indication to necessarily do a stress test. It's simply a marker that this patient has advanced, well, they have coronary artery disease, and that they need to really focus on their risk factors.
I see.
So one of the criticisms of the test has been that in certain communities, it may lead to unnecessary other diagnostic testing, which just drives up healthcare costs. So it really shouldn't be used for that, and it's mainly just a screening test.
Gotcha.
So,
Which is why, again, I think you mentioned that the ideal patient is in a certain category. It's not really
Right.
good for everybody.
correct.
And that's
Yeah.
important to know. And I guess the bottom line is if someone is thinking about it or questioning or heard about it and thought, well, maybe I need to get one of these, talk to your primary care physician, maybe get referred to a cardiologist, but at least have a conversation with your doctor to see if
Right.
you were in that sweet spot of people who might be helped by this screening.
Well, again, you don't need a doctor's order to get the test at the hospital.
Right.
You can call into radiology there to schedule one, but they will ask who your primary care provider's name is.
Okay.
Because we'd like to send the report not only to the patient, but also to your provider. But you don't need a doctor's order. You could call and in order and get the test there
Okay.
done on your own. You would just call scheduling for radiology at the hospital.
Gotcha. But if I had a question, I could certainly talk to my doctor.
Yeah, absolutely, right.
But if I got $100 burning a hole in my pocket,
Yeah.
I guess I could spend it that way. So you're right.
Sure.
Very, very true. I want to go back and talk a little bit about heart attacks and some of the warning signs for heart attacks and issues like that, because I know a lot of times, some folks maybe are having some of these symptoms, but maybe they kind of dismiss it as indigestion or something else. And then, of course, as we said, time is muscle. And so if they don't deal with it, it could be a bigger problem down the road. Is that still true? Is that still what you see sometimes with patients?
Yeah, that still holds true. And the classic symptoms of crushing chest pain, a weight on the chest, discomfort radiating up to the jaw or down the arm still applies. Most patients that I see don't describe it as a true pain. They would describe it more as a pressure, heaviness, tightness. Those are the more common terms. However, in our patient population here with huge population of diabetics, diabetics are the number one group who have what are called silent heart attacks. So they do not have the typical symptoms, and they may have very vague symptoms, which may include just new onset fatigue, new onset shortness of breath with exertion, lack of energy, sweating without an apparent reason, nausea. So we always caution diabetics about not relying exclusively on chest pain, because you can't.
Right.
But unfortunately, many of these patients show up having already had a heart attack by the time we see them, just because they didn't have typical symptoms. The other group that we see silent heart attacks more often in our elderly patients. For example, patients who may have dementia, or patients who just are older. They may not have typical symptoms.
Gotcha.
So we're always real alert to that.
Yeah.
So.
Very much so, too. Sure. And I wanted to ask you, too, since I have you here, is we always think about heart attacks dealing mostly with men, but women still can suffer a heart attack and still can have some of these symptoms as well. And it shouldn't be ignored that women have the same risks as men do, don't they?
They do. And women typically present a few years after men do in terms of the peak incidence of heart attacks, but actually may have higher rates of heart attacks as they get older than men. Women also may be more likely to have atypical symptoms. They may also be a group that to be more aware of in terms of not having the typical chest pain. And there are subsets of women who have heart attacks that are not associated with typical coronary artery disease. They may have what's called small vessel disease, which is disease of not the major arteries that run on the surface of the heart, but the very small, what we call microvascular disease. So yeah, they are a population of patients that you also have to be more alert for not having typical symptoms.
Right.
So.
Very true. And of course, mostly I would think it's mostly older adults that have heart attacks, but can this be an issue with children or teenagers or younger adults too? I know it depends on the patient. You really can't make a blanket statement, but is that something that folks should at least be aware of?
Yeah, so the younger patients that we see with heart attacks in this community fall into certain groups. Diabetics would be the number one group, particularly type 1 diabetics. Those are those that are on insulin generally and who were diagnosed quite young, would generally show up at an earlier age with heart attacks. The other younger groups of patients we see with heart attacks are smokers and substance abuse. And within that category of substance abuse, the major groups we see are cocaine and meth use, and we do have a large problem with that in this town.
Right.
And actually, many of those patients also end up with heart failure too. So, yeah, substance abuse is a big issue. Yeah, so those are the major.
So young
groups
people
there.
can be impacted by this as well,
Yeah.
and I guess it also then says that if someone is coming to you suffering from a heart attack or symptoms of a heart attack, they may also present with other issues as well. They may be suffering from other health conditions or addiction or what have you when they show up at the ER in many times.
Yeah, and we routinely will do a drug screen on younger patients showing up with heart attacks.
Right.
So
Makes sense to do that. So very good. Just have a couple of minutes remaining this morning, Doctor, and I wanted to ask you to repeat again the details of the Healthy Living Expo that's coming up again a week from Saturday. It will be out at McGee Park, and of course the hospital is a big partner with the San Juan Health Council. So before I'll let you go, if you wouldn't mind repeating a little bit of the details on the Healthy Living Expo.
yeah, so it'll be Saturday, February 21st from 10 a.m. to 3 p.m. Free admission. Just a lot of useful information on heart health. And yeah, so I think if you have any concerns about your heart health, it would probably be a good idea to attend.
Yeah.
So
Very true. A free event at McGee Park again, and
Right.
folks from San Juan Regional will be there, and a lot of other organizations, and so a great opportunity to go out and learn more about our health and how to be healthier in the new year. So it's a great chance to do that. So very good. Dr. Stephen MacKerrow, thank you for coming in this morning. I always appreciate it.
yeah, thank you for having me.
Nice conversation. Thank you very much. My guest this morning with me here on KSJE.
Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.